The heart attack symptom women over 60 almost always miss. It has nothing to do with chest pain. If you are a woman over 60 and you think you would know if you were having a heart attack, I need you to stop and really listen to what I am about to tell you. Because the image most people carry in their heads, a sudden crushing chest pain, grabbing your left arm, collapsing dramatically, that is largely a male pattern. And for decades, it is the pattern that medical research was almost exclusively built around. Women experience heart attacks differently, sometimes dramatically differently. And because those symptoms do not match the picture we have all been shown on television and in health brochures, women over 60 are dismissing genuine cardiac emergencies every single day. They are waiting. They are assuming it is something minor. They are apologizing to emergency room staff for bothering them. And they are dying at rates that should alarm every woman watching this right now. I am Dr. Steven, and this channel exists to bring you the latest evidence-based research on senior health, translated into clear, practical information designed specifically for adults over 60. If you have not subscribed yet, please do that right now, because what I am covering today could genuinely save your life or the life of a woman you love. Let us get into exactly what is happening and why this has been overlooked for so long. Why women's heart attacks look so different. Here is the foundation you need to understand before we get into the specific symptoms. The heart attack research that shaped medical education, treatment protocols, and public awareness campaigns for most of the 20th century was conducted almost entirely on men. Women were dramatically underrepresented in cardiovascular clinical trials for decades. The result is that the classic heart attack presentation, that dramatic crushing chest pain radiating down the left arm, was defined by male physiology and male hormonal patterns. Women's hearts are not simply smaller versions of men's hearts. After menopause, when estrogen levels drop significantly, a woman's cardiovascular risk profile changes substantially. Estrogen had been providing a layer of protection against arterial inflammation and plaque buildup. When that protection decreases, the pattern of how heart disease develops and how it presents during an acute event shifts in ways that medicine was genuinely slow to recognize and document. A landmark study published in the journal Circulation followed over 500 women who had survived heart attacks and asked them to describe their symptoms in the weeks and days leading up to the event. What the researchers found was striking. The majority of these women did not report chest pain as their primary or most prominent symptom. Many reported no chest pain at all, yet they had unquestionably experienced a serious cardiac event. So if it is not chest pain, what is it? Let me walk you through the specific symptoms that research now confirms women over 60 most commonly experience and most commonly dismiss. Symptom 1. Unexplained and overwhelming fatigue. This is the symptom that women most consistently describe in the days and weeks leading up to a heart attack, and it is the one most consistently explained away as something else. We are not talking about the normal tiredness that comes at the end of a full day. We are talking about a profound, bone-deep exhaustion that appears without a clear cause and does not improve with rest. Women describe feeling too tired to perform tasks they complete effortlessly every single day. Getting dressed feels exhausting. Walking to the kitchen feels like an effort that requires recovery afterward. Sleeping 8 hours and waking up feeling as though they had not slept at all. A study published in the American Journal of Critical Care found that over 70% of women who experienced a heart attack reported unusual fatigue as a symptom in the weeks preceding the event. Over 70%. That is not a rare warning sign. That is the most common warning sign women have. And yet, because fatigue is so easily attributed to age, to stress, to poor sleep, to thyroid issues, to a dozen other explanations, women and their doctors routinely miss what it is actually signaling. When your heart muscle is not receiving adequate blood flow, it works harder to compensate. That compensation draws energy from your entire body. The fatigue you feel is your cardiovascular system telling you that something is wrong at a fundamental level. Comment below right now and tell me, have you or someone you love experienced sudden, unexplained fatigue that seemed out of proportion to your activity level? I want to understand how many women in this community have felt this without knowing what it could mean. Symptom 2. Shortness of breath without exertion. This one catches women off guard because it seems to come from nowhere. You are sitting quietly, you are lying in bed, you are having a calm conversation, and suddenly you cannot catch your breath the way you normally would. It feels like you have just climbed a flight of stairs, except you have not moved. Or you wake up in the middle of the night feeling breathless and slightly panicked, and after a few minutes it passes, and you tell yourself it was nothing. Shortness of breath at rest or with minimal activity that is new, that was not present 3 months ago, is a significant cardiac warning sign in women over 60. Research published in the journal Circulation found that shortness of breath was actually a more reliable predictor of heart attack in women than chest pain. When the heart is struggling to pump blood efficiently, fluid can back up into the lungs. The lungs become slightly congested. Breathing requires more effort even when you are doing nothing at all. Many women attribute this to anxiety, to weight changes, to simply being out of shape. And sometimes those explanations are correct. But when shortness of breath appears suddenly, is new to you, and is accompanied by any of the other symptoms on this list, it demands immediate medical attention. Let me tell you about a patient I will call Eleanor. She was 67 years old, active, not overweight, and considered herself in reasonably good health. For about 3 weeks before her heart attack, she had been waking up at around 2 in the morning, feeling breathless and slightly unsettled. She assumed it was anxiety related to a family situation. She mentioned it once to her daughter, who suggested she try to manage her stress better. Eleanor did not call her doctor. When she finally arrived at the emergency room, she had already experienced significant cardiac damage that would have been substantially reduced with earlier intervention. Symptom 3, nausea, indigestion, or stomach pain. This is arguably the most dangerous symptom on this list because it is the one most likely to send a woman to the wrong place for the wrong treatment. Nausea, vomiting, stomach cramping, a feeling of severe indigestion or heartburn that does not respond to antacids. These are documented cardiac symptoms in women that are routinely mistaken for gastrointestinal problems. The nerve pathways connecting the heart to the brain travel near pathways that also carry signals from the stomach and digestive system. When the heart is in distress, the brain can interpret those signals as coming from the gut. This is called referred pain and referred sensation. It is the same mechanism that causes some people to feel jaw or shoulder pain during a heart attack instead of chest pain. Women are significantly more likely than men to experience nausea and stomach upset as their primary heart attack symptom. A study from the National Institutes of Health reviewing hospital records of heart attack patients found that women were far more likely to report gastrointestinal symptoms and far more likely to be initially evaluated for gastrointestinal causes before a cardiac diagnosis was made. That delay in diagnosis costs women critical time when the heart muscle is being damaged. If you experience sudden severe nausea or indigestion that feels different from what you normally experience, that does not respond to your usual remedies, and that is accompanied by any unusual fatigue, sweating, or discomfort anywhere in your upper body, treat it as a potential cardiac emergency until proven otherwise. Symptom 4, pain or discomfort in the jaw, neck, back, or shoulders. Most people know that left arm pain can accompany a heart attack. What most people do not know is that in women, the discomfort is far more likely to appear in the jaw, the neck, between the shoulder blades, or across the upper back. It may feel like a dull ache. It may feel like tension or pressure. It may feel like you slept in a wrong position and your neck is stiff. It comes and goes. And because it does not feel like what most people believe a heart attack feels like, it gets ignored. Or women take pain reliever and go back to sleep. Research published in the journal JAMA Internal Medicine found that women experiencing heart attacks were significantly more likely than men to report pain in locations other than the chest, specifically the jaw, neck, throat, upper back, and shoulders. These areas all share nerve pathways with the heart through what is called the cardiac referred pain network. If you are over 60 and you develop unexplained aching or pressure in your jaw or upper back, particularly if it appears alongside any of the other symptoms we have discussed, please do not dismiss it as dental pain or muscle tension without ruling out a cardiac cause first. Symptom 5. Sudden cold sweats, dizziness, or a feeling that something is wrong. This last symptom is perhaps the hardest to describe clinically, but women who have experienced it describe it remarkably consistently. A sudden cold sweat that has nothing to do with temperature. A feeling of lightheadedness or dizziness that comes on without standing up too fast. And perhaps most powerfully, an overwhelming sense that something is simply wrong, that something serious is happening. Women in cardiac research studies describe this feeling of impending doom with striking consistency. Many say they knew something was seriously wrong but could not identify what it was, and many of those same women waited hours before seeking help because they could not point to a specific chest pain that felt dramatic enough to justify calling an ambulance. A cold sweat accompanying any of the symptoms above is your autonomic nervous system responding to cardiovascular stress. Your body is diverting blood to your core organs. Your sweat glands are activating. This is a physical emergency response, and it should be treated as one. Why women wait and why that. Waiting is Deadly research published in the European Heart Journal found that women wait on average 37 minutes longer than men before calling emergency services during a heart attack. 37 minutes. During a heart attack, the heart muscle is being deprived of oxygen. Damage accumulates every single minute. The phrase cardiologists use is time is muscle. Every minute of delay is muscle cells dying that did not have to. Women wait longer for several deeply documented reasons. They do not recognize their symptoms as cardiac because those symptoms do not match the male pattern they have been taught to watch for. They do not want to overreact or seem dramatic. They worry about inconveniencing people. They assume they are too healthy, too active, or too young to be having a heart attack. And sometimes their initial medical evaluation misses the diagnosis because the presentation is atypical. A 2020 analysis published in Circulation found that women under 75 who arrived at emergency rooms with heart attacks were less likely to receive timely diagnostic testing compared to men with the same presentation. This is a systemic failure with life and death consequences, and awareness is one of the most powerful tools we have to fight it. What you must do with this information right now. First, memorize these 5 symptoms together as a pattern. Unexplained, overwhelming fatigue, shortness of breath without exertion, nausea or indigestion that feels different and does not respond to normal remedies, pain or pressure in the jaw, neck, upper back, or shoulders, and sudden cold sweats or a powerful feeling that something is wrong. You do not need all 5. You do not even need 2. One of these symptoms, new and persistent, warrants a call to your doctor that same day. 2 or more together warrant calling emergency services immediately. Do not drive yourself. Do not wait to see if it passes. Call. Second, know your personal risk factors before an emergency happens. High blood pressure, type 2 diabetes, a history of smoking, elevated LDL cholesterol, a family history of heart disease, chronic inflammatory conditions like rheumatoid arthritis. All of these substantially raise cardiac risk in women after 60. If you carry any of these risk factors, your threshold for seeking evaluation should be lower, not higher. Third, request a full cardiovascular risk assessment at your next doctor's appointment. Ask specifically for a fasting lipid panel, a fasting blood sugar or HbA1c, a resting blood pressure measurement in both arms, and a conversation about whether additional testing, such as a coronary calcium score, is appropriate for your individual risk profile. Women are less frequently referred for these assessments than men of equivalent risk, and advocating for yourself in that appointment can make a meaningful difference. Fourth, share this information with every woman over 60 in your life, a daughter, a sister, a neighbor, a friend. The gap between what women know about their cardiac symptoms and what the research actually shows is one of the most consequential health literacy gaps that exists for this age group. One conversation, one shared video, one forwarded message could be the reason someone calls for help when they otherwise would have waited. Heart disease is the leading cause of death in women in the United States. It kills more women than all forms of cancer combined. And yet it remains under-recognized, under-researched in women specifically, and dramatically under-discussed in the conversations women have with their doctors and with each other. The symptoms are real. The biology behind them is documented. The danger of ignoring them is measurable. You now have the information to recognize what your body may be telling you, and more importantly, you have the information to act on it rather than explain it away. Comment below with the word sharing if you are sending this to a woman in your life who needs to see it. Comment your age and which of these 5 symptoms you have experienced without knowing what it could mean. Your comment may help another woman take her symptoms seriously. I am Dr. Steven. Please subscribe because next week we are covering the one blood pressure reading pattern that cardiologists say is a far more accurate predictor of stroke risk in women over 65 than the standard numbers your doctor checks at routine visits. That information belongs in every woman's hands. Take good care of yourself. You deserve that.